Okay, welcome you guys. I'm so excited. This is our first speaker series for the Vet Tech program for the fall. We're so excited to bring this back. I think this is season 3 we've been doing this. So I'm super excited. I'm even more excited for this one because we are welcoming some local amazing folks from the Watauga Humane Society, Ashlee and Hansen. And Hansen is actually a registered veterinary technician and a graduate from the App State Vet Tech program. And they're going to talk to you guys about introducing new pets to your family, because I know a lot of people do that with the upcoming holiday season, and also talk about fostering, which is an amazing way to give back. So I'm going to hand it off to them. Thanks, you guys.
Yeah, thank you for that introduction. Give me just a second. I'm going to go ahead and share my screen, get this rolling. Okay. Sorry, technical difficulties. There we go. All right, welcome. We are here to talk about strategies for blending pets and fostering, presented by myself, Ashlee Yepez, Director of Shelter Operations, and Hansen Dendinger, who is our medical technician. So a little bit about ourselves. I've been with Watauga Humane Society for about 12 years now. I started off as an animal caregiver. So I was doing the animal husbandry, helping people with adopting their pets. And I've since moved into the role of director of shelter operations and have been in that position for about the past 6 years now. So my ultimate role is to oversee our staffing, the animal care that's provided through our medical team, through our animal care team, as well as all of our life-saving programs.
And then I'm Hansen. I have been working at the Humane Society about 7 years now. I started at the tail end of 2018. Also started off as an animal caregiver, and I've now been our medical technician for about 4 years now, or one of our medical technicians. We have two. And my job is kind of overseeing all of our treatment protocols, coordinating with local veterinarians about the care that we are providing for animals, making sure that we're staying within our limits as an organization without a veterinarian on staff to provide the best care that we can, while also compromising and scheduling veterinary exams and procedures as necessary to make sure everyone in our care stays happy, healthy, and adoptable.
Yeah. So a little bit about our organization. We know that some folks that are joining us today may not be here local to the area. So our Humane Society is a local nonprofit located in Boone, North Carolina. We are a 501c3, but we do have a government contract with Watauga County, meaning that we bring in animals from our local animal control. So we are taking in not only owner surrenders, but also strays, as well as any animals that are seized from animal control. We are a no-kill organization with an average save rate of 95% each year. So if you're not familiar with what no-kill means, the basic standard is that 90% of animals or higher entering your care are being saved. So we average 95%. But even with that being said, one of our staff members recently said, well, it's only 95%. We put 100% effort into giving every animal a second chance. And then one of the things that we do as a facility who is open to the public, we do more of a managed admission style. And we roughly care for about 1,700 animals each year coming through our facility. So you want to adopt a pet or, bring a pet into your home. So how does one prepare for that? This is actually Seamus. So all the animals you see in this slide and these slides will be animals that are currently in care or have been adopted from care. So you'll get to see all of them. But we always want you to do some soul searching before you are looking at bringing a pet into your home. Just a few questions that might be beneficial to you before you start thinking about, or while you're thinking about bringing a pet into your home. Why do I want a pet? What am I looking for in this companionship? What are the things that we do see a lot of? Do I hope this relationship looks similar to that of an old one? We don't want anybody kind of looking to replace pet companionship. It's always going to look different. Every animal is unique. Am I mentally and emotionally ready for a pet? And how do I envision life with a pet? And do I hold realistic standards? And if you're asking, what do those realistic standards look like? Kind of look where your mind is at. Have you considered your living situation? Do you have a fenced in yard? Do you not have a yard at all? Are you in an apartment? Have you considered your time, between your different, jobs or school or extracurricular activities that you're a part of? Have you considered what your routine is like and what that might look like shifting with adding an animal into your home? And your financial stability. What is that financial commitment that you're putting towards an animal? And with all of that in mind, have you done pet research? Do you know what you want to adopt? A cat versus a dog, or a small critter, or a reptile? A lot of this will focus mostly on cats and dogs, but have you done that research onto what kind of pet you're looking to bring into your home? And kind of what to look for in a companion. We do, when you're coming to us, we're going to ask you, like, what traits are you looking for? So do you have a certain size in mind, energy level, a training history, or a personality? You'll notice I didn't put breed on there. We always say to never judge a book by its cover. We actually do not breed label any of our animals here at Watauga Humane. So we're going to do everything that we can to learn about that animal and any animals coming into our care. So when you, as a potential adopter, are coming to us, we can help pair animals with you based on what you're looking for in those traits. But if you're not local to our area, you have other humane societies or other animal shelters in your area, we're always going to push and encourage you to look at your local humane society or animal shelter first. There are so many animals out there who need a place, a home, a person, and your humane societies and animal shelters are full of them. You can also look online. So there are online websites such as Pet Finder, Pet Tango, that can take a lot of the traits that you're looking for and kind of filter it through and help navigate you to different facilities if you're not familiar with where to look. There's also breed specific rescues. So if you are for any reason looking for a certain breed, there are rescues specific to that. So we will encourage you first and foremost to try that if you're looking for a certain breed. And then there are local as well as regional rehoming pages. So this is where owners themselves are attempting to rehome their pets. So you might find that you get a little bit more information than you would from a humane society or a municipality who may not have as much information or as much context to the information provided. And if you, for any reason, find that you are going to go with the breeder, we always recommend doing research, make sure you're finding an ethical breeder. Going to that one random pet store and that like shopping mall, probably those puppies are not going to be ethically bred. We do not want to support puppy mills. And then how do you prep your home? So essential supplies, that's going to be dependent on whether you're bringing home a cat or a dog. I always recommend start off with the basics and then incorporate what you need later on. Your pets are going to be individual. So you don't need to buy all this shampoo or ear cleaner, things like that. Like bring them into your home first. Make sure they can sleep comfortably. They can use the bathroom comfortably. You can exercise them comfortably. And feed them and give them water as well. But all the other things, the cat tower, the awesome harness for hiking, like those can all come later once you've gotten to know your pet. Hansen, you want to talk about an adjustment zone and what that looks like?
Yeah. So for most pets, when they come into your home, you are a stranger and your house is an entirely new, odd environment for them. So even while a home environment is much more calm and stress-free than a shelter environment, your pet is still going to have a time frame where they are uncertain of their surroundings. And I feel like this is something that we encounter a lot with our adoption counseling is we get a pet home, they aren't immediately comfortable, or like Ashlee was referencing, where you want to figure out kind of what you're expecting from your new pet first. We get a lot of, well, my old dog, never wanted to be out in the yard, and this dog always wants to be out in the yard. And so during this adjustment zone, you guys are learning about each other. Your dog is or your new pet, foster or adoptive, is going to have some weird quirks that you may not be accustomed to, and you're going to have some weird quirks that they're not going to be accustomed to. So during this adjustment period, it's important that you have like separate spaces for your foster pet and new pet if you're integrating them with a new animal, which I think Ashlee will talk a little bit more about on this next slide. You'll also want to make sure, that you are having realistic expectations for this animal in this kind of beginning period of your new relationship. Um, and so during this time, you're going to want to be pet proofing your space. So we're going to pick up any electrical cables, shoes, things that you don't want an unassuming pet to be nibbling on, moving around your house, anything like that. And you're also going to want to really establish a routine during this time period. So if you already have a pet in the home, that's great. You can piggyback off of their routine and kind of introduce this pet to the way things work in your home. If you don't already have a pet, you're going to want to go ahead and set a schedule that works for you guys. So, when do I have class? When do I have work? Does this animal seem like they're needing to go outside more frequently, less frequently? Are they alone more often? And giving them that sort of stability that will allow them to adjust to your home environment without the unpredictability in those first few weeks. And then lots and lots of patience. Obviously, like I said, this pet has just met you, and you've just met them. You're going to have a lot of road bumps, and there are a lot of resources for you. Hopefully, through the organization that you're going through, if you adopt or foster through us, we're always happy to provide post-adoption counseling or point you in the direction of resources that can help if you're having like training issues. Lots of local trainers, quick Google search, no matter where you are, can help put you in contact with people to help kind of make this adjustment period as smooth as possible.
Perfect. Thank you. So now that you've kind of considered, okay, what kind of pet do I want? I've already taken the steps to, look or go to my local humane society and look at pets. And now I'm at the point where I'm introducing a pet into the home. So how do I blend them together? First of all, we want you to know about the rule of threes. So 3, 3 days, 3 weeks, 3 months. This is kind of a rough timeline of where your new pet is going to be feeling in the home, and feeling with you, feeling with others. And as Hansen said, this is an adjustment period where it's going to be an adjustment for your new pet, existing pets in your home, for yourself. So just always making sure that you're patient with all of the above. But for the first 3 days, your new pet might be anxious. They might be hiding. They may refuse to eat or drink. This is why it's really important to have a decompression zone. Some people live in small spaces, and that's okay. Whatever you can do to kind of give them their own safe space that allows for the animals to really kind of like start to learn the sounds and smells of the home environment. By 3 weeks, we'll talk more about like what that looks like, blending the pet into the home. But by 3 weeks, you should have a more comfortable pet. The true personality will start to show by this point, which also means that you might see more naughty behavior. So for example, we'll see really shy puppies go into a home environment and they're so cute and they're so docile. By 3 weeks, they're a monster. They want to chew on everything. They've wrecked all your plants, all of the things. This is why you prep your home. But also, they're getting more comfortable. So they're going to test the limits with you at that point. They're going to really start to see, this is a toddler. They're really going to start to see what they can or cannot do. And they also may still have moments of anxiety. So they may not be 100% comfortable. Because again, they're testing the waters here. And then by 3 months, you're going to have a much more relaxed, more confident pet that really should feel at home with you. This is where true bonding really starts. So when you think about that companion that you had growing up, we see a lot of young adopters coming to us, getting their own first pet in adulthood. That pet that you think so fondly of, that your family had for 15 years, that was like the best pet. They went through this. They went through the 3 days, the 3 weeks, the 3 months. You just don't remember. And that's okay. I didn't remember when I got my first dog. It was hellacious.
I barely remember the dog I have now, and I got her 4 years ago, or 6 years ago as an adult. And I'm like, she's always been fine.
Yeah, like it just happened. So, but by 3 months, that's when you're really going to start bonding with them. That's really when comfortability starts to happen. So when you do start to blend your pets into the homes, you really want to keep in mind those benchmarks of the 3-3-3. So creating separate spaces is really important. We'll talk about this with fostering as well. But it is really essential, especially when you're doing species to species. So cat to dog, it's a safety thing. So you're going to want to have separate spaces where, again, you have a well-established dog in the home, you're bringing a cat in. They have like a small bathroom or a bedroom that they can hang out in. They have easy access to their litter box, food, and water. They don't have a whole house that they can run and hide, get lost in. We've had animals end up in the walls. You just don't want that happening. So you really want to create a separate space that allows for them to feel comfortable and safe, gives them a place to hide, and really start to integrate them into the space by swapping scents first. So you can do where you take your existing pet's, blanket or bed, whatever they have, and switch it with the like item for the other pet. And you want to do that you want to go slow with that, but you also want to do positive reinforcement through all of these steps. So when you're swapping blankets, maybe your pet is getting their favorite treat and your new pet is getting something like pets from you or whatever is going to be their positive reinforcement. And you're just going to take it slow. You'll do some introductions, through a door. Again, cats tend to like paw, very raccoon-like, hands out the door, bat at each other. Dogs are going to want to sniff. Cats might be right there. So you can kind of encourage them to be introduced to each other through a door, through a cracked door. Anytime that you're doing species to species introduction, when it comes to a dog and cat, your dog is going to be leashed up, or your new dog will be leashed up with your existing cat in the house. The cat will always have free reign. And the reason being is because cats want and can get high. Dogs, on the other hand, will just kind of go and barrel through things. And while they also can get high, they will destroy a lot of things in the process of doing that. So you really want to go slow. You really just want to ensure that that you realize that this is a new pet and they may not have ever had experience with a similar species of their own or with another species. And just always patience, because growth is not linear. You are going to go through highs and lows through the process of bringing in a pet into your home with or without other existing pets.
Also, just to tack onto that,
Yeah.
it's totally okay to have a negative interaction in your introduction process, especially cat to cat. Never is a smooth transition. So if you have one non-overwhelmingly negative interaction between your two new pets, it's okay to separate, allow for a day or two of decompression, and retry that introduction in a different setting. If you're introducing, dogs to dogs, your dog may be frustrated by being on a leash while this other dog also is. And you may want to try introducing in neutral spaces or non-neutral spaces. And same thing with cats. Even if you do your introduction 100% perfectly, you're probably going to have a lot of spitting, maybe some like distance little smacks for the first few weeks that you have them. And it's totally okay to retry these introductions as much as you can to kind of keep stress levels down and slowly desensitize our pets to these new friends in our home.
Absolutely. So I don't see any questions in the chat. We can kind of give it a second. And then we could always move on to part 2. All right, we'll go ahead and move along. If there's any questions about part 1 that come up later, just type them in there and we can always address them at the end. We'll have some Q&A options then. So you've done all of the, emotional research. You've done all of the, what can I accommodate in my home? And maybe you're not like 100% committed to committing to fully bringing on an animal, fully taking on the financial commitment. So you want to talk about fostering. So we'll talk a little bit about what fostering looks like for us. It mimics a lot of what other facilities are doing as well. So if you're in another area, if you just ask about fostering, your local Humane Society is going to be able to answer questions about what they do specifically. So for fostering is beneficial to a pet's mental and physical well-being, to shelter pets' physical and mental well-being. We see animals come from all sorts of demographics, as well as with little to no history. We do have some with history, but we have animals coming in that truly need kind of more than what can happen here in the shelter environment. Again, we're bringing in about 1,700 animals a day, or sorry, oh my gosh, not a day, a year. We have anywhere from 130 to 170 cats on site. Our dog population can fluctuate from 30 to roughly about 60. We don't really tend to hit over that. But there's only so much that we can do in terms of time and attention to each singular animal each day. So it is also really supportive for sick, injured, or socially inept pets. And it's also helpful to those looking to learn more about animal care. So again, if you haven't had a pet before, if you're looking to see what integrating a new pet into your home environment looks like, you do not have a commitment to anything other than like making sure this animal stays alive and can come back to their Humane Society to be adopted. And fostering is also free, at least with us. So there's no commitment. There's no commitment from us for financially investing into your foster pets. We find that some people do, but it is completely free. We supply all of this, everything needed, from food bowls, food, water bowls, leash harness, crate, carrier, all of the things that might be needed, we will provide, including disease control as well. And why should you care about fostering? If you're like, I'm just going to adopt, or I'm just going to go to a breeder, you should care about fostering because we have thousands of animals entering facilities like ours nationwide. If not over millions. And you should care about fostering because fostering saves lives, point blank. In 5 years, we've increased our dog fosters by 177.5%. Our cat fosters by 286%. And that is a great number because most of those are going to be kittens. They're going to be babies. They're going to be puppies and kittens that literally cannot survive without some type of adult, whether it's their actual dog or cat mom or human parent helping them. It provides essential care that cannot be achieved in the shelter environment. It reduces the risk of injury and illness spread, while also keeping living spaces available to those who truly need to come in. So foster parents become kind of an extension of our capacity. And when it's done in alignment with other life-saving programs, it can end the unnecessary killing of healthy adoptable animals simply due to space limitations. And we say the unnecessary killing of healthy animals because that is what it is. Humane euthanasia is reserved for animals who are suffering, in pain, or have behavioral components to them that are dangerous to put them out into the public. That is not the case for that healthy dog that loves every child and animal that comes up to them. And that's what's happening nationwide. And we want to be part of life-saving options, and you can help be a part of life-saving options by fostering. You can actually see that last year we had a total of 948 fosters. And of those fosters, we had 26% that were for medical cases. And then 32.2% were actually fostered at intake, which means that someone brought those animals to us expecting to be able to bring them into the shelter environment, and we turn them into a foster parent instead. For one of two, multiple cases, we don't have space. If we don't have space, we don't have space. We have nowhere to put that animal. So you become the space that is available. We vaccinate, we deworm, we do all the things necessary to ensure that they can be, kind of started on their health journey. But just not with us because we don't have space. It could be that they're too young. So neonates, animals that still have to be bottle fed or that are not of age to be adopted, which is 7 to 8 weeks old in North Carolina. So if they're a 5-week-old kitten that can eat a little bit of, softened kibble, we still can't adopt them out for 3 weeks. That kitten is more likely to be immunocompromised, more likely to get sick, can potentially injure themselves in the living space that they're here, and they're kept in a smallish space. It's kind of like what you would see in one of the vet clinics that you might be doing an internship at. That's what they're living in kind of like a back of house area, because they're not able to move to our adoption floor where they have more space. So we really depend on fosters. The animals depend on fosters to be able to provide them with that essential care, and as well as make sure that we have the space to kind of continue to move animals in a positive way through adoption, through other types of fostering, through transfers out to other organizations as well.
And fostering also, the importance of fostering, we can go back to kind of our definition of no kill as well. We are incredibly fortunate in that as a private organization that just has a county contract, we're able to say, if someone brings us in a litter of 5-week-old kittens, we don't have an open space for them. We can say, look, we're going to go ahead, vaccinate, deworm your kittens, send them back into foster with you, and we'll bring them into the shelter environment to be adopted when space allows and they're old enough to be adopted. When we have more municipal shelters who rely solely on a relationship with the county, they don't have that privilege. They have to take in that animal no matter what their space looks like, which is where we run into the necessity on their part to kill or euthanize an existing animal to make space for these animals coming in. So making yourself available as a foster parent, even to your local, what might be classified as a kill shelter, will help provide life-saving space for them and give them the leeway to be able to, figure out a game plan in order to bring these animals in rather than having to make an immediate decision on the life of an animal. And we find here, while we don't ever euthanize for space, when we see a dip in fosters, we see much higher increase in crowding in the shelter and therefore, like Ashlee was saying, disease transmission, which does put lives at risk. So even if these animals are healthy, we are able to provide medical care. If we were a less equipped shelter who couldn't provide medical care, we may be put in a much more compromising position with the health, well-being, and longevity of these animals if we did not have foster parents available and willing to help us.
Absolutely. And kind of on that note as well, if you're unhappy with where your local shelter, animal control, humane society, and their practices or what they're doing, not every facility has the same resources. You yourself can become a resource to them. You can donate goods and items to them. You can donate your time as a volunteer or as a foster parent. And you can also speak up on their behalf, hear what their problems are. Do they have problems with like voting for your county commissioners? Matter, because those are the people who ultimately help make these decisions in these organizations. So you can be a part of life saving beyond the walls. And that's what we always tell people is like, oh, that's so great. Like you're a no-kill facility. It doesn't happen within four walls. It happens because we have a great relationship with our county. We work with animal control. We have refined what our programs are. And we've also been able to not only for our staffing, really train them and what it looks like to kind of mitigate when the community is coming forward to us, but really we've been able to empower community members to be that voice for other community members as well when we provide that education. So education is a huge pillar to what we do. It's going to be a huge pillar to any humane society. But once you're educated, then you have that capability of spreading that awareness as well.
Ashlee, I was just going to interject just to give you kudos and a big plug. I had never fostered before this last year, and you were overcrowded and put out a call on the Facebook page saying we could really use some fosters. And so we took little Cubby. We have an existing dog, Tug, who's a great guy, but he's a big guy. And I said, as long as he's very friendly. So if they get along with other dogs, he'd be a good big brother. And it really worked out. And we had Cubby, I think 2 to 3 weeks, but like you all have said, they provided everything. And I think it was an effective foster because we were traveling and had to return Cubby and he got adopted the next day. But I think, to be honest, our dog Tug did so much to help with socialization because we have a nice fenced in yard. So Cubby was like, this is a nice safe space for me. This is a good place to play. I like this. And Tug was like, it's okay. They're okay. They're weird, but it'll work out.
Yeah,
No,
and we.
and
Oh, sorry. Go ahead, Ash. Oh. But we do see, especially with dogs, yeah, a lot of the, it's a lot easier to socialize like a kitten or a cat in a shelter environment than it is a dog. And so, especially, and we'll talk about it a little later. But yeah, Cubby, obviously those of you listening who are not Mary Beth do not know Cubby, was not the most social butterfly when he came to us. And we do see a lot of the times when we have these under-socialized dogs coming into our care, even, yeah, that short period, like 2 to 3 weeks outside of the shelter, with like a dedicated foster parent and then a well-rounded, well-adjusted dog in the home, is like magical for these dogs in such a short period of time. And usually once we get them over that threshold of apprehension, they open up great. Even if they're back in the shelter environment, they kind of have like the essential building blocks to being a dog that let them adjust a lot better for the remaining time in the shelter and then to their adoptive home as well.
absolutely. And that's kind of what I was going to say, because of Mary Beth's notes and photos and information that was able to be provided. Cubby did get adopted because we had all these wonderful things that we could say about how Cubby did in the home environment and how he, integrated with a dog, a confident dog. And it really was just like sold to that person who adopted, and, he's still thriving today, which is great.
Yeah, and
I
that's one
think
of the
that's
other quick benefits of fostering is a lot of the animals that come to us are strays, and we have no background on them. So when even if you're fostering just for the week or two, like Ashley's saying, beforehand, if someone came in interested in adopting Cubby, and they said, how does he do? Is he housebroken? We would shrug. We have no
well,
idea.
no, yeah.
Yeah. And Mary Beth or other foster parents are able to provide us with that essential information, like, oh, almost has the hang of it. Or, terrified of the vacuum, does terrible on a leash, does great on a leash. And so we get that vital information to report back to adopters, even if the foster parent isn't the one intending on adopting.
Kind of going back to learning more about the personality of that pet, so that way we can adopt them out that way. Fostering is so beneficial to that. And that's where we kind of get to considering your demographic. So again, if you're looking at fostering, we have hoped that you have done that soul searching, you've done all of the logistics of your home environment. And so now you can consider the demographic that you can open your doors to. You'll see a lot of cats on here. We do need a lot of cat fosters, but our dogs always need it as well. But yeah, sick or injured pets. You see this nasty little kitten on here. We see a lot of those that happen. There's a kitten season. This is what we see a lot of. They do not thrive in the shelter environment. They need their faces washed more often. They need more frequent feeding. They might just need to be in a bathroom with a shower with humidity running. Like, we can't do that in the shelter environment. We can't provide this top-notch care that we want to provide. We can do the best that we can. But really, as a foster parent, you may not think, I can't provide that much. You have a shower. You can make a steam room. You have that capability. We believe in you. Under socialized or behavioral pets, we see a lot of those as well. And just like Cubby, we're going to see puppies that have come in, or adolescent dogs that have come in that may have never been inside of a home ever. They may have only ever lived outside. We have very rural area around us. So there is also kind of a difference in what pet care looks like between different generations of demographics of people in our area. So we're going to find that some animals have only ever lived outside. They've only ever known people when they're getting fed, and they're coming to us because there's a mindset change. And then we have this under socialized dog who is afraid of passing through thresholds and hates the feel of anything that's not dirt below their feet. So fostering is going to be really beneficial to those, as well as kittens like this little spicy one on the screen, who are without kind of that time and attention in a really quiet environment of just patiently sitting with them, you're not going to really get to see them come out of their shell. We see a lot of kittens who were born from a community cat. They're not owned by anybody. They just breed like cats do, which is very similar to bunnies in terms of just how often they're breeding and how many they're breeding. So then this cycle starts of these kittens being in the community, and they're not really being interacted or socialized with people. So then they come in and they're like, you're aliens, you've abducted me, I hate you, I'm gonna fight you, where are my siblings at? There's this whole thing that's going through them that we have no idea what's happened, but we could really use fosters for.
And this kitten,
Go
oh, sorry, I
ahead.
was gonna say this kitten specifically, chocolate chip banana bread, is still here. All the other kittens or animals on this slide have been adopted, but our other medical technician, Hannah, took this photo 2 hours ago. So if anyone is interested in an angry, pointy, sharp creature to live in their spare bedroom or bathroom, she would be so happy. Look how happy she is. She would be so happy to come live with you for a week or two.
She in fact has ears. They're just
She
down.
does. You can find them. It's like a
not
treasure.
earless. Yeah. Put your hand in there. We would obviously teach you safety. We're not encouraging anybody to get bit around here. But Neonate, Hansen, and I, as well as most of our cattery team, have experience with bottle feeding. We see it more frequently with kittens than we do puppies, though it has happened on occasion. But kittens need to be bottle fed almost until 6 weeks old. There's been some puppies that are they're 3 weeks old and they're ready to start chowing down on some food. They shouldn't, but it's very different for kittens. They need to be on a heating pad. They need to feel like purring. They need to feel like they're being groomed. They need to be stimulated, which are all things with puppies as well. But we see way more neonates, kittens than we do puppies. And they very literally, like, their eyes aren't even open. They can't hear anything. They can only smell at that point. And yes, they do try to hiss. It is the most adorable thing, with nothing but gums and just and then we do end up as a facility who focuses on giving all of our animals a second chance. We're putting 100% effort into them. So long as they are mentally, physically thriving in the shelter environment, we will get long staying animals. So we will have long staying cats and dogs, but we see it much more frequently with dogs, that they are here. We are enriching them. We are prioritizing getting them out for walks and play yard, and prioritizing going into a foster home, because they're going to be here a while for one reason or another. It could be because of their size, their breed. It could be that they don't thrive well with other animals. It could just be that we have no history on them, and that they're just a brown dog, and that just they don't attract as much attention as like a really fluffy, cute, small dog. Where like we're like, stop it, go away, stop fighting people at our door for. They're just kind of sitting there and might appear like boring, but just because they haven't really had a chance to like really blossom or shine. So healthy, long staying or senior animals are really going to benefit from fostering as well.
And then on our next slide, for introducing fosters to your resident pets, this is going to look a little different than introducing your adoptive pet into your home. And this is because if this animal is available for foster, at least in our case, outside of like senior animals or healthy, long-staying animals, these are going to be pets that are not quite ready for adoption. So as we addressed on the last slide, these pets may be under-socialized. It may be space necessity. So this cat has been with us for, 3 to 4 days, and we need to open this spot for a new incoming animal. They may be sick or injured. And so these are animals that we would not typically, put our stamp of approval on for going into an adoptive home. So before you bring a foster pet in, it's important to remember that a lot of the time, especially with cats and kittens, we have little, if not no history on this animal. We don't know if they've ever been vaccinated. We don't know if they've ever been in a home. We don't know what sort of illnesses they could have been exposed to in the past. And even if we do have this information, the shelter is a group housing environment. So disease spreads a lot easier here, no matter what we do in terms of practicing disease control, making sure everyone stays separate, sanitizing and sterilizing between different animals. The risk of that disease transmission is just a lot higher. So if you're bringing this animal into your home, we don't have a way of knowing if they've come in contact with something nasty that they could give to your pet. So kind of our gold standard is keeping foster pets separate for 2 weeks from your resident pets. And you'll learn this in your pathology class. Almost every disease, no idea why, has a 2-week incubation period. 2 weeks is kind of typically that mark where we would expect to see some sort of symptoms if they've been exposed to a respiratory illness or, parasite activity, anything like that. We would see symptoms most often by that point. So if you reach day 15 of the animal in your home and there's been no change to their like mental, physical well-being, no new weird symptoms, it's probably safe to go ahead and start following all of these previous integration steps to have them meet your resident pets. Of course, fostering is an individual and voluntary obligation. So this is just our recommendation and our gold standard. If you get an animal home and you decide to introduce them after 3 days, that's not our recommendation, but it is your prerogative. You should just be aware, and you can talk with your local shelter if you're not local to us. Most humane societies are not able to provide follow-up medical care should your animal become sick from a foster pet. So in our case, if you bring home most commonly a small kitten with an upper respiratory infection.
Little guy.
Yeah, this little guy, Nidalee. If you were to take Nidalee, you look at that crusty face and you say, this should be near my other cat. I have questions, but you're allowed to do you. And your cat begins to show symptoms, getting veterinary care for your pet would be your responsibility and obligation. Also, most places with this 2-week mark, let's say day 10, you're like, ooh, little crunchy, little sniffly kitten. If you reach out, we can then go ahead and start medication, or if you are worried about transmission, you feel you're not able to aptly keep your pets separate, we can, your organization can work with you to schedule a time to bring that pet back into your shelter environment to keep your pet as healthy as possible. And then for us, we try to provide vaccination and medical records where possible. So obviously, if we have an animal come in same day, they go into foster, all you're getting is, she got her FVRCP this morning. But if this is a cat that's been in our care for a slightly long period of time, they've been seen by a vet, we're going to provide you with all of those notes so that you are up to date on kind of the situation, what is going on there. And then, yeah, this is also a judgment call as well. If you're taking in, a 10-week-old puppy that we found in the woods 3 days ago, going to be a lot higher risk than your senior cat who was surrendered with 6 years of vet records. So your team at your local shelter, or if you come here to us, will be able to kind of game plan with you as to what's appropriate in terms of confinement and introducing this pet to your resident pets as well.
Awesome. And what fostering spaces look like? So for 2 weeks, you're like, what am I doing? Well, you're keeping them separate. It's going to be dependent on the foster pet's needs. So again, it's going to be dependent on like how long an animal's been in the shelter environment, what their medical history is, have they been apparently healthy, have they been on and off sick, all of the different things that someone like a Hansen would kind of educate our team members, or her herself would come out and speak to you about what that looks like and why you should be keeping your pets separate, or if they could get introduced, what that might look like. Just kind of fun fact for what we do here, we can introduce healthy pets from another home, specifically dogs. We don't do it with cats, but healthy dogs to healthy dogs here in the shelter environment, as kind of like a brief introduction where you can do it with a staff member who is skilled with that. I believe we did that with Mary Beth and her dog Tug as well. So these foster spaces are really going to be dependent on what that foster pet needs. So it might be a true quarantine area, or it might just be like, this is where I put them when I leave for the day to keep them separate from my pets. This space should always be easily sanitized, because in the event that you bring in an apparently healthy animal that then becomes sick, so something happens where like whatever had been kind of like incubating in their body now starts to come out, it should be really easily sanitized. For all of our fosters, we do offer a packet on disease control, disease transmission, and how you can sanitize your spaces. Neonate kittens are oftentimes confined to a cat carrier. That's a very easily sanitized space, but you don't want to put it like in your closet with all of your clothes and your shoes on the ground. That just feels like less easily sanitized if it's an aerosol type disease transmission. So you maybe want like a bathroom space instead. And it should be located in a part of your home with low traffic. So when we think about these adjustment zones, these decompression periods, those first 3 days, you really want to keep in mind that you've taken an animal from an environment that is loud, robust, full of smells, full of sounds. Dogs that may not like other dogs barking constantly because they can hear and smell other dogs. Cats that, while our facility is great, there are still spaces where like if dogs are loud enough, they can hear dogs. So it can be triggering to their like fight or flight responses, to their like immune systems, etc. You're taking these animals out of these spaces and then you're putting them in a really quiet space. It's going to be jarring for them. So, always, never taking a new animal and be like, okay, great. Now we're going to take you to the groomers today and you have a vet appointment scheduled for tomorrow, and which fosters should not be scheduling vet appointments. But if we're talking about adoptive pets, you just don't really want to overstimulate them, or just like really like, set your pet up to be in all sorts of different situations before you've really gotten to know them. And this is inclusive of your foster pets, because again, we only know what we know of them in the shelter environment. We don't know what happens when they get into a home environment. So it's going to be very different.
Also, just to interrupt real fast, we did have a Q&A question that I did not see. Someone asked, can you talk about the foster to intake program? I know of several kittens that might benefit from this. And just to go over that real fast, in 2022, I think, we kind of moved away from, especially with kittens, we were seeing our lowest save rate with. So for our overall population, it's 95%. I think for kittens, we were down to 88% at one point.
I think we like hit 89%, but we had seen kind of like a tracking decline. So we were kind of like on par to hit 88% the next year.
Yeah. And so that is because, like we've talked about, like kittens are much more susceptible to illness in the shelter, especially, once we vaccinate an animal, it does take up to 14 to 28 days for that vaccine to be efficable in preventing illness. So if we're vaccinating a kitten at intake and then putting them in a group housing situation, for the first 14 days, it's kind of like we didn't vaccinate them. So around 2022, 2023, we started moving towards, let's say you, anonymous attendee, show up at our door at 12:30 with a stray kitten. Great. We are setting you up with everything you need to foster and to make sure that this kitten is happy and healthy in your home for the next 2 weeks. And if we hear, oh, I just didn't really want to foster, I was planning on just bringing them by, we can explain all of these things to that person. So we are not able to take this kitten in. It's not medically responsible, nor is it socially responsible to bring this kitten into the shelter at this time. And so unless there's a true emergency, like this kitten is injured, needs to be seen by a vet, failing, or this kitten was found by a college freshman in a dorm who truly cannot keep them, we don't really give people a lot of option. You're taking these kittens into foster for at least 2 weeks. And again, that 2-week mark, that's the incubation period again for all of these illnesses we're concerned about, most notably panleukopenia, which is the feline parvovirus. We can make sure that if this kitten tests positive, they test positive out of the shelter, and then we can kind of create a quarantine isolation plan for them from there. Or that if this kitten stays happy and healthy for all 14 days of foster, then that vaccine we gave them at intake is now efficable. We give them a booster vaccine and they can come into the shelter environment a lot more productive than they were beforehand. So foster or intake to foster has been a really big part of kind of our life-saving goals over the past 4 years or 3 years. And I think our kitten save rate last year was up again to 92%, 91 or 92. So we saw a 2 to 3% increase just in forcing people to foster. It's a much more friendly forcing, but it is a forceful suggestion. I will say.
It's based a lot on education. So there's a few of us who work intake specifically. We did at one point have an intake coordinator, and we found that is a really easily burnt out position, which if most people who are on here are part of the vet tech program, like you are going into a field where it can be really hard emotionally to be resilient when you're kind of seeing all of these things happening day to day. So when you're in intake, you're hearing a lot of people who like are kind of trauma dumping, like why they need to bring their pet in. They are emotional, and emotions can range from like really, really sad to really, really angry. And you're having to be like the calm, collected one that's providing people with that information. So we kind of have one person who kind of mostly does it now, but there's a few of us who kind of take on the responsibility of like, okay, this is a topic about this animal, this dog that this person's had for 12 years. And for the past 6 years has attacked a child every single year. That is not a great dog to bring into the shelter environment, because we are more than likely are not going to be able to adopt that animal out. So we need to have like more thoughtful, intentional conversation with them. That might be 30 minutes. It might be multiple conversations, etc. Because again, we're here to be a community resource, which can either be that we are helping bring in an animal, or we are helping keep an animal out of the shelter environment, which is really beneficial to ensuring that we have space for animals who do need to be here. And I think that kind of goes back to like our slide about communication here. Like if you are fostering, it is a non-negotiable. Like if you have an animal in your care, we have to know like the disposition of that animal, if that animal has continued to do better, has continued to worsen for some reason, has an injury. For ourselves, we provide all of our fosters with an email form of communication, a phone form of communication, and we've also recently adapted our contract to say, like, you can show up in person, because a lot of people were reaching out to us waiting for a phone call back, and then their animal was not doing great. Their pet was not doing great, and they were waiting for us to call back, and we couldn't. So we've made it really clear that, like, yeah, we are open, but like, this is when we get here. Like, we have to take care of animals before we're open to the public. Like, show up. We would much rather you show up with an animal that is not doing great, so we can interfere immediately as soon as we possibly can, versus like finding out that this has been happening for days. It's not ethical on any part for an animal to be suffering in that way. So we really try to make it very clear, like, communication. We would much rather you over communicate than just not communicate at all, because communication is life-saving.
We have one foster parent. Her name is Anya, and she has fostered. I think she
already
just
hit 200 kittens.
Yeah, she just hit 200 kittens. Started fostering with us during the pandemic because she has 4 daughters, and they were like, "Ooh, wonderful thing to do during COVID together." We've watched all of them like graduate high school and go off to college. And Anya has all of our cell phone numbers. She has acquired them somehow. We don't typically give out our cell phone numbers, but if you hit 100 kittens, you earn a cell phone number. And yeah, we get if she has a kitten, there is not a day that goes by we do not have a communication from her. It may just be like, "Oh, Benny had a great poop this morning." We're like, "Awesome, Anya."
He's up 100 grams.
He's up 100 grams. And yeah, would much rather have you emailing us every single day than reach out at the end of your foster and be like, "Ooh, yeah, they haven't eaten anything since I got them." So yeah.
We're like coming in for your scheduled recheck, and then we're like, "This cat is sick now. Like, what happened?" "Oh yeah, like the sniffle started about 5 days ago." Would have been great to know, because we have them scheduled to come back and stay in the shelter environment, and now they can't. Now
yeah,
you have to foster
doxycycline is a
longer.
hell of a drug.
Yeah. So yeah, communication is just so important to everything when it comes to fostering. But yeah, intake to foster has really been beneficial. Like Hansen was saying, we saw this tracking decline in kittens, and we knew that we had to interfere, because ultimately all of us are here because we want to help animals. We want to advocate for them. And that also means being strategic about it as well. So, being able to look at where are our gaps in life saving, and like, we are a business. Like, it's not just based off fields, like it's based off statistics that we have, that we can make these choices, and that we can be educated so we can educate the public as well. So when we started doing this for kittens, we realized that when you truly talk to people, and once it clicked for people, it wasn't that hard to get them to foster. So we started doing it with everybody. We're like, "Oh, you found this dog? We do not have space. Do you want to foster? Oh, you really like them? You've already had them at your home for 2 days. Well, what's one more day? Was 2 more days?" Like, even just giving like 48 hours of foster care gives us time to like find another foster parent if needed. But like, if you can actually do the 2 weeks, like, that's awesome. That's solid. Like, we will go ahead. We'll have it on our calendar. We'll make sure that we run an adoption special just to make space for like all these animals coming back. Like, we are pretty rigorous when it comes to our own communication. So everything is documented. We have spreadsheets, we have calendars, and it's all transparent with all of our staff members as well. So it really helps us kind of like stay on point. If one of us fails, we all shame each other. We don't actually, but we might bully each other just a little bit. You forgot to put your note in. But yeah, intake to foster has been incredible, and it really is. You've done an amazing thing. You've saved this animal's life, from an apparently dangerous situation, a kitten without its mom. You've done the right thing by waiting to see if mom comes back, etc. But now we're here, and we're at the doors where we can't actually take them in. So what can happen next? If we can't take them in, but you can't keep them long term, like forever life, let's find a happy medium, and fostering is that happy medium, and it has been incredible. I think that in the years that we've been doing foster to intake, we've been able to help over 100 more kittens each year, and our save rate has increased.
Mhm. Yeah, and we schedule all of our owner surrenders as well. So if you go to surrender an animal to our shelter, and also actually all no-kill shelters will do owner surrenders by appointment. And so that allows us to make sure that we have space before we bring an animal into the shelter. So like Ashley's saying, when we have kind of a heads up about a stray animal coming in, that is vital for helping us ensure that space, especially we leave a space open since we work with animal control if we have a true emergency. So, if we have an owner who's arrested or passes away, or we have someone who's unexpectedly experiencing homelessness or has a medical crisis, we have a space for that emergent pet that's not filled by a very fosterable 3-month-old kitten.
Absolutely. And I think that's all.
That's all, folks.
That's all, folks.
So yeah, if anyone has any questions, happy to answer those with the last 4-ish minutes we have left. Or if you think of questions after this, you can always stop by the shelter. If you want to learn more about shelter medicine or our foster program or adopting or bringing an animal in or doing maintenance or volunteering, we love to talk. None of us ever shut up. We will talk with you.
As we've done for this past hour now.
Yeah.
Well, thanks for spending this hour. And just for anyone attending today, we do record these sessions and we post them on our website. So if someone wanted to come and had a conflict and couldn't make it, it will be available. So we certainly appreciate your time today, Ashlee and Hansen.
Yeah, thank
Absolutely.
you so much.
Yeah, thanks for having us. Thanks for the degree. I appreciate it.
Thanks for having us. Thanks
Welcome.
for her degree as well. We're really benefiting from it. So
Thanks, everybody.
All right. See you later.
bye.